Well, hey, I'm Dr. John, and I'm a pediatric dentist from here at PDAO in Fayetteville. And today we're going to be talking about something that's got a lot of attention from some of our patients and people in the clinic, and that is the Caries Risk Assessment. And so basically, whenever I introduce a topic, I kind of like to break it down one word at a time to make it make as much sense as possible, then just kind of put it all together. And so we'll take it word by word. And caries is the first word of the phrase, and caries is considered the decaying condition of a tooth, or tooth decay. It's what we call the condition that results in something that everyone knows as a cavity, or like a hole in the tooth, something that can cause pain, infection, inflammation, and can cause loss of function ultimately and require treatment. And so that's the first word in the phrase. The second being risk. Risk is basically like the probability or likelihood that something is to occur in the future based off of what we know now or from the past. Lastly, the word assessment basically just means like a device or tool or instrument used to like collect some information to hopefully draw a conclusion after maybe just some analysis. And so you put that all together. Caries Risk Assessment basically means a device or instrument used to collect some information to designate a patient or somebody as more than likely going to get a cavity in the future, or maybe not. And so we, basically give this information to tell patients and their parents, like, look, here's some things that we noticed based off our examination and maybe based off an intake form that we have here at the clinic that can help us identify, look, maybe there's like an increased risk in the near to mid future that, your child may or may not get a cavity. And, interestingly enough, a patient can have no cavities, and they may actually require that we place a high caries risk only because we just noticed one thing or two things in an exam, or something that like a parent indicated to us, like maybe they like to eat sweets 4 or 5 times a day. Even if it's just a little bit, just the frequency of that alone can kind of indicate someone that's being high caries risk or increased likelihood of getting a cavity. And so really our job is to take this information and then to come alongside you as the parent, and then to say, this is something we noticed, and maybe we can partner with you to give you some tips to, maybe improve this or that at home to hopefully, avoid kind of seeing us more than twice a year if possible. And so basically, when we're talking caries risk assessment, it's just two things we're looking at. There's modifiable factors and non-modifiable factors. The non-modifiable factors, those are the things we really can't modify. Like there's some, health conditions that can result in cavities kind of being formed more easily. And those are some things we want to bring attention to so that we can come alongside you and help you kind of navigate that to avoid cavities. But there's also those modifiable factors that are of particular interest to us, because those are some things we get excited to say, oh, hey, we can identify this and say, yeah, we know this can cause cavities based off of some information that like the American Dental Association and other various scientific authorities on oral health care have identified. And then so we just let you know about that, and then we partner with you, and then basically, hopefully we can reduce the risk that we'll get cavities, and then we'll just be able to see it once, twice a year. This has been a little discussion on caries risk assessment, and hopefully you found it interesting and helpful.